And welcome back to Dr. Noah's Natural Medicine Update. It's part 6 of diabetes type 2. And as we've been talking about, we've been showing the benefits in terms of health and well-being of basically different types of factors there. What you don't see is in terms of the overall health and well-being of each individual in terms of going way beyond just basically sugar control or weight loss. Basically overall, as we showed before, overall health and well-being in terms of many, many type of factors I can see there. Overwhelming evidence in terms of helping the body keep healthy in all aspects, from inflammatory, sugar, cholesterol. And so once again, we showed the science basically supports that, and there's just absolutely no question in terms of the scientific literature in terms of health and well-being. So that's what's great. So who benefits from this? Anybody from high cholesterol, blood pressure, diabetes, obesity, osteoporosis, you name it, basically has a factor to do. And the cost is very reasonable. And of course, first-line therapy has lots of other types of interventions. So we want to basically try to understand that what we're doing is we're actually working what's called epigenetics, working with the genes influence from the outside versus the misconception that the genes control us. And so that's what's kind of exciting, is being able to understand that we have this new type of technology to actually communicate with the genes and be able to manipulate them and actually either turn them on, upregulate, or downregulate to turn them off at our fancy. And that's a very exciting type of research in terms of helping the body be able to do that. And so by looking at different factors of what we eat, once again, that goes all the way down to that genetic material of our body and makes us either healthy or sick. And that was shown in the 2000 New England Journal of Medicine article that looked at almost 90,000 identical twins, and what they found out, it was exactly what lots of doctors have been saying, especially like a Bruce Lipton, is that the environment is 90% of either our health or our sickness. And so don't be fooled by this, that it's not your fault, and your mother and father. Well, the reason why your mother and father are sick like you, because they have the same kind of lifestyle environment. And in fact, there's only about a very small percentage of genetic disorders out there. Most of the people out there has control over that. And that's what makes it exciting. It doesn't make you a bad person. It just basically you have to take charge of your health and well-being. And so we can show you here in terms of different types of factors in terms of using nutrition and having a completely different type of outcome in terms of this mouse here in terms of high cancer risk, diabetic, obese, and reduced lifespan. That's what they're bred. And then giving them nutrients, special type of, special but zinc, special amino acids, some different types of B vitamins, and they were able to basically reduce those factors like that. And that was published in 2002 Journal of Nutrition. So science supports that. Once again, is that what you do, especially if you're becoming either thinking about conceiving or being pregnant, is what you do even before the baby comes out has a big factor in your health and well-being.